Hi Roswitha, hi Muskaan. Thank you very much to accepting my invitation. It's very nice to see you here.
Thank you for inviting us.
Yeah, it's really excited to be here today.
Thank you so much. And as I learned from both of you that you have a very different journey in your private life, how you met with each other and how you came to this YON E Health company, which is very interesting and it's a very promising company, how you get to this point.
How we met each other?
Yes.
Actually, through LinkedIn, because I realized that I'm in much need of a chief clinical officer. And of course, I had a preference of a female. And we did some research online and also through our personal connections and some of our previous business connections that all led us to you. And I just reached out, actually, and the rest is history.
Absolutely, and here we are now. I think it was quite out of the blue that I got Roswitha's message, and we just connected over LinkedIn. And it was quite exciting to see what they're doing with YON E, because I'm very passionate about women's health in general, and I've worked in women's health like most of my career. And so we got talking, we had like the first chat, and we instantly like clicked. Yeah. We realized that we've got lots of like moral grounds. We, really understood each other in that sense, and yeah, we're here now.
Yeah. Oh, it's a very nice story. And just stepping one step back, so how you started then YON E Health?
Yes. So unfortunately, that doesn't really start with a good starting point because I grew up in safe houses due to abusement, and I was really exposed to the problems in women's health and basically the lack thereof, and the extreme living conditions that me and the women in our group were in really affected fertility and vaginal health. So unfortunately, I also experienced for more than a decade to be misdiagnosed, receive the wrong medication and information. And I thought at a certain point, okay, this needs to change because our body is telling us so much, especially our vaginal health during our cycle. And none of us actually knows what's happening with that data and what it's actually telling us. So I basically used my background in business because I'm used to scaling startups in Europe and the US. I'm from the Netherlands, but also lived in New York and now in Budapest. So I just utilized that knowledge for private equity as well and scaling startups to focus on health and just basically transform the traumas that I have for a purpose. So it took a while to get to that point, but I'm happy that I can utilize my pain into something so beautiful that can hopefully touch women globally.
What was the exact time when you started the idea of
During
YON E
COVID,
Health?
actually, yes. And the device, what we're now developing, was not the first idea. Actually, the first idea I had it is sold by Whoop. It is a lingerie with a chip. So it was a good idea as well, if I might say so. And I realized that it's measuring the data as well, but it does not give us the actual data from the vagina itself. And that, I think, was so critical with the YON E device. So some version were established before, and that's right now we are with our YON E device that give with the biomarkers inside by measuring pH and temperature in your full cycle.
Muskaan, can you just tell all of our visitors that why it's so important to have this information?
From a medical standpoint, we often don't really hear about tracking pH or basal body temperature. Of course, you hear that a lot in like fertility clinics, but commercially, you don't have a product that exists that can do it on a daily basis. And that is what we actually need to manage the cycle, to understand what's actually happening with your body, and give women this empowerment to make an informed decision. So pH, we know, is such an important factor, especially for the vaginal microbiome, and even a slight change can cause dysbiosis and can lead to tremendous, very adverse infections, and as well as sometimes can even lead to cancer. And the other biomarker that we're measuring is basal body temperature to track ovulation, to be precise. And this will help lots of women to track their fertility, track their cycles, and be a very important indicator even for clinics, which would give them instant results, which usually you've got to wait for a couple of days to get your results back. So I feel like this is extremely important in women's health and in generally reproductive and gynecological health to understand these two biomarkers. So it's quite interesting because we're also doing lots of analysis in our labs that we partner with, and we're trying to do cross-sensitivity analysis and trying to do our own research around these two biomarkers and see, just get more data out there and see what we can do with this beautiful, amazing data that we will have from our research.
Yeah. And also, just to jump in there, that we are finally able to focus on different ethnicities. That is also really, really important, because the slight change in pH, and many times when you go to a doctor, they give this overall measurements that every woman has these, but it's not the case, because depending on your ethnicity, the level of pH is also different.
It's quite interesting you say that also, because like I feel for everything, all the benchmarks that were set were by only one specific ethnicity, because like until the early 90s, women were not even a part of research or clinical trials. So it's astonishing how we've lived all of these years with all of these great therapeutic methods, and they were not actually designed to be made for women to start with. And I feel like, because our main focus, because all our team we're from around the world, so that's something that we want to bring into our product as well. And we want to create this as authentic as possible, and not to some benchmarked standard of whether the West has set. And so we're trying to be as inclusive with ethnicities as possible, because lots of women from all around the world, especially the global South, have got extremely different ranges of even pH throughout their cycles. Even like things like menopause happens at different times of with different ethnicities, and people don't know anything about it. There's no one, like, I wasn't taught about this in medical school. Were you? Like, they don't teach us this in medical school, and we only get to know about this when we practice and when we see patients, and we sort of
imagine not going to medical school. You have at least no idea at all.
Absolutely, like something that I think you get to know about these things when you do your own research and actually learn about, the nitty-gritty of things like pH and all of these other factors. And I feel like it's extremely important that we start talking about this and bringing all of these things onto table where they've been missing for God knows how long.
It's so strange that it's so basic information.
Yes.
The pH, the temperature, and how is it not used up to now?
Luckily for us in this case, because we are able to also file patents, but it's shocking, of course, because the data that will be able to collect your device can make such a big change in healthcare research and pharmaceuticals. Unfortunately, it's been just decades too late, but I'm happy that we are able to do so with our team. And I think what is also nice with YON E Health is that we are trying, and we will share our story and behind the scenes with our audience. So for the first time, they are also having a better understanding what it takes to build a medical device and what it takes to scale a startup and do it on a global scale. So one thing for us is really important to build that trust already before even launching our medical device, because trust and transparency is really important. And I feel like that is also basically what makes us different, to really connect with our audience on an early stage.
And we're actually so happy that this is actually our first time together sitting across the table, the YON E team. And we're so gladly that you have, we're doing this with you, because obviously you've trusted us from the outset, and you've, put all of your trust in our abilities. Because right now we don't have a device. We've just got this vision and this idea and a medically strong backing. So we're really glad that we get to put out our story with you as our first, live audience, whatever you can call this.
So thank you for that.
Thank you so much for that.
It was an easy decision. So we just talked about yesterday, and we listen our other podcast with other investors, that your team is so extraordinary. And then when we met just a couple of weeks ago, first time, or maybe it was about 2 months ago, how you explained and all the dedication, what you presented, it was so shockingly positive, and it's very rarely visible in this area. It's very important. On the other hand, I have some background, because my PhD, I made my PhD in gynecological disorders, so it's not far away. And also digital biomarkers, clinical research is my main research topic. So I'm just really glad that we met. Yes, even it was just by chance, but I'm very happy. And just turning back to YON E Health. So how do you see the next steps? Where you are now, and what are the next steps?
Yes, so exciting for you to hear as well. So we are really on schedule. We will be, if things go right regarding the testing, we will be able to, depending if we close co-investment by the end of this year, but we will be able to go into clinical trials next summer. So that's quite exciting. We have all the stakeholders in place. Of course, we already have regulatory affairs in place. So for focusing on CE mark, FDA approval, and then clinical trials, approximately we assume 9 to 12 months. And then we, of course, in the meantime, we will work hard to focus on our branding and marketing to launch our device in clinics and into the market. So it's quite exciting actually to accelerate on such a, actually since we met you, we accelerated, of course, through the investments quite strongly.
Tenfold. And just to add a bit of context for our listeners who might not know what testing in a medical device is, so any medical device that needs to go out commercially in the market needs to go through what's called as the technological readiness level testing. So depending on the complexity of your device, you can do as many steps as you want. So the first initial usual step is to validate your proof of concept. So we're already past TRL1 and we're now in TRL2, which for us means validating this proof of concept in a lab setting. So we are trying to use the pH, the sensors that we're going to use for our device in a simulated vaginal fluid. So we're using calibrations, buffers, trying to be as dynamic as we can and mimic the real life vaginal fluid and even like blood and things like urine and semen.
Environment, you have to mimic the environment.
We've got to mimic the exact same thing that the sensor is going to be exposed to. And so that's what we're doing currently in our labs. So, and after this, we move on to do, further testing for the outer shells and to see what's compatible and what's, the toxicity, endotoxicity, develop like cleaning cycles for the device in general. And then once we've got our first prototype, we move to do user testing and just refine the prototype even more. So throughout this process, we're also hand in hand following the regulatory, sort of making the SOPs, following the ISO regulations, basically. And then we'd, eventually after everything is done, after we've got the clinical evaluation protocol and the clinical evaluation plan and everything is, after it's done, then we just submit to the notifying body. And then you get your CE mark. So that was just like a context for the listeners.
No, it's quite exciting because also based on your recommendation, we work, of course, with EBI, and it's like really such a strong and smooth partnership with them. And it's also exciting because we are already preparing for the first version 1 prototype. And if everything goes right, and we will be able to do that in Q2 of next year. And it will be, of course, also for us really exciting to have.
It's a huge milestone.
That's a really big milestone. And for me, it's really, because I'm doing this now for 3 years, and raising funds is extremely hard, of course, especially as a female founder, because we all know that only 2.3% of funding goes to female founders. And to actually see it come to life and to see all the things happening that we worked so hard for, it's really beautiful. And actually already a lot of women reached out through socials, like, can I already purchase the device? Can I sign up? Like, where is it? And please use me for testing, like whatever they can do, they already want to help. And it's really, sometimes they also share really painful stories about fertility and IVF, and that gives us extra fuel that we know, like, this is exactly why we want to do it. So it's beautiful to see on one hand, to see it come to life, and on the other hand, already seeing the interest of our audience.
It's very interesting. You just mentioned that very few number of female leaders, they get fundings and they get attention. Why is this huge imbalance between the male and female funders? That
is a really good question, and I wish I had the answer. Honestly, I don't know. And the thing is, within that number, it's all women. So imagine we focus on vaginal health. So you can imagine the conversations we sometimes had with investors who have, like, you have a lot of background, of course, in women's health, but imagine someone is interested in tech or deep tech, and then you start talking about vaginal health and they get super uncomfortable, or they get shy, or they say, like, do women really have that as a problem? Like, that's why I'm here, yes. So you have a really short time to, of course, pitch your company and bring the vision and the problem and everything else over. And then when the person in front of you doesn't have at least a little bit of understanding of the problems in women's health, then you just don't have enough time. But that's, of course, only within Femtech. I don't know the rest of the reasons why investment goes with such low amounts to women, even though it's proven that we give a higher return of investment. So that's quite interesting. So hopefully soon it will change.
Yeah, and I feel like as women are inherently, as we grow up, like, most of my female friends and like all of our shared experiences, we've always been taught to like excel. So I feel like that's also another reason why we keep at it, and we're constantly trying to prove ourselves in every setting we are in. And that maybe is the reason why we have a higher rate ROI for, per male capita. Because I don't know, but it's sad that this investment is such a low only to female founders.
And I think that because it takes sometimes, and also with Yoni's case, years, that when you do finally get it, you will do everything to protect it and make sure you hit the milestones, you make sure you're dedicated. Because I worked for startups with male founders, and I also know how it is to basically work in a toxic man environment where investments are going everywhere besides the actual scaling of the company. So at least it was good for me to also see how to not do it, at least. And I feel like women, because we need to prove ourselves so much, that when we do get it, we're like, we're going to show you that we got this.
Like, watch me.
But as I see and I understand from our previous discussions and your articles, that is it also your mission to give more attention to the entire Femtech environment. So not just YONE, which should be and it will be. I'm confident that it will be a flagship project in this industry, and I really hope that you can show a very good example for other female leaders how to do it and what is the best practice. Are you sharing this information with people or similar leaders?
So that's also one of the reasons why we're planning to start our own podcast, to not only talk about the issues in women's health, but also talk about business and like growth and like financial topics and data, just like everything that's important to just bring awareness, because women, people in this case have many times such good ideas, and it's just unfair if there's such a big bias against us. And I've been through so many cohorts globally, and I've been through so many startup events, and now actually when I do get invited for a startup event, I immediately ask what's the ratio, because if I'm the only female founded company there, it already feels a bit intimidating. And then I'm talking about vaginal health, so that's that taboo or that noise what you hear in the room, of course that's quite uncomfortable. Now I'm quite dedicated to I'm going to break the taboos, but I can understand that not every woman has that personality. So I want to make sure that we open the doors for these kind of women to actually make it a little bit easier, I hope. So, yeah.
And I also feel like it's not just about showing our success and showing what we're doing great. It's also about the struggles that we're going through.
Of course, it's part of the
because
story.
it's a part of the story and it's a part of our lives. And everybody goes through these struggles, especially it's not easy to build a business from scratch and to scale it as high as we want to scale it.
And accepting the no's, there's hundreds and thousands of no's.
So because one thing I did, going through all the no's, one thing I've been doing consistently is just listening to people who made it and who scaled multiple startups or exit multiple startups or just multimillionaires. And one of the first things that they told me, just get comfortable with no. It's good to get no because you learn from it. It's not the right investor, not the right profile, but never take it personally. Of course, in some cases, maybe the idea is just not strong enough. But if you just get comfortable with the no, not take it personally. In the beginning, I didn't have that because it was quite intense. But then I realized, someone told me, but just think about it. What if 10 more no's lead you to the yes? That means that you just want to get the no's over with and just focus on the yes. And that's the mindset I've been having, to just focus on the positivity and just never give up. And I think in my case, with the background I'm from and with the dedication and seeing and live the experience and the pain, I think that was also what keeping me going whenever I had hard days or whenever I honestly didn't know what to do or didn't saw any light in the end of the tunnel. I just thought that I thought back about this women. I was like, no, I will never give up on this idea.
Very strong drive.
Yeah.
But you just mentioned you were shy in a conference. I cannot expect that this word shy and you it's just not coming together in my mind.
In the beginning, the reason why I was shy is because when I did private equity, I traveled a lot. I've been to a lot of conferences, a lot of podcasts, but then I changed to medical and I realized I have zero connections, nada, not even one in healthcare. And then in 6 months, I ended up in Forbes because I just used the same formula and just be comfortable by being uncomfortable. Because I also told you today, the first pitch I ever did was on a huge stage in Paris Femtech, and we ended up in the top 10. But I don't even remember the pitch. I totally blacked out. So somehow we did good, but I totally blacked out. I was really nervous, and because it's good to be comfortable in what you're doing, but I was consistently uncomfortable because healthcare is back then it felt like such far of my bad show. And I was like, I'm going to build a startup. I'm going to do medical startup, medtech device. And people looking at me like, huh? I was like, yeah, I'll figure it out. And we did.
I think the main difference, what I see, I'm in connection with many startup companies and spin-off companies that, and it was also the reason that I make this decision so quickly, that because you are a founder, you have this very strong drive. Everybody accept it, and that it's gonna be a success. So that's why I think it's a huge difference between your story and the average. So it is much above the average, and I think it's very important. And also the team you have, it's also also very interesting, and it's very important to see that you have a very, very international team, a very dedicated team, and it is also quite rare. Honestly, it's not a common case.
I think it also brings a lot of perspectives to the table, and you need like all perspectives to build something global, and that's what we're trying to do at YON E as well. But like that's interesting because when we first spoke over like video call, when you had not decided yet that you were gonna invest or not, so after that, like during that chat, what made you feel like, oh, I should actually put my money into these people?
Yeah, as I mentioned, the feeling. So, of course, we made the professional due diligence, and you remember I sent not hundreds of questions, but dozens of questions, and you answered very quickly. Also, the response time, I like it. So
we're on it.
I'm really upset that somebody is coming to me asking money, serious money, and they are answering my emails after 3 days.
No, for me, that's
a no for us.
Even with our stakeholders, when we notice that they need like 4 days to respond, we're already calling them like, listen, we need this going.
Yeah, and I feel like when you're trying to get something done, you have to, like, especially in a startup, you have to be a doer. So you can't just like sit back and say, okay, I'll wait for 4 days for an email. That's never going to come back.
No, because you do, like everyone has a phone in their hands, or you see it actually coming in. So of course we filter down on priorities, and we work on different time zones. So there's no, every time zone we are. So you can reach us.
There's no waiting for us. Like that's something that we actually instill in our wider team as well, just to be very prompt and to like at least give us deadlines. If you're not able to get to us, tell us and we'll expect, whatever. It's fine, life happens, but we're very strict on deadlines.
And what is also really good in our case, I really worked hard on finding a strong advisory board. And even them, I can just call them. Like, for example, with the due diligence, I immediately called everyone to listen. Today, we need to be all on top of it. And everyone immediately was also helping because, of course, we have finance and we have fundraising. We have also legal. And I think that's important with scaling a startup as well, that obviously I'm not strong in these departments. So you need to find someone that believes in you and that is also actively available to help you out, because we're all working to raising funds. And imagine we cannot reach the advisory board to help or give advice. So I also instilled this work environment that we're always in communication with each other. Yeah.
Was it difficult to find these advisors?
Yes. Yes, because I realized that I'm just going to be transparent right now. Sometimes on LinkedIn, people have this image and they have a lot of titles and awards, and then you think like, whoa, and especially when you're like an early stage founder, you like get quite fast impressed. And then you realize, because what I'm doing is, of course, everyone that's on our team with an advisory, like we track the deadlines, we have meeting minutes, like we make sure it's quite easily visible if an advisor is not doing what they started doing. And then I've been going around asking for advice, and they said many times board members or advisory board members, they just like to have that title, but they don't actually do anything. I've been through that as well. And then I was really realizing I was uncomfortable because as a young founder, you need to basically tell them that they're not doing what they promised and they're not doing it like right. And then I felt like quite uncomfortable because they have so much more experience. They scaled many companies, and then I need to tell them it's not working out. So again, I just needed to get comfortable by being uncomfortable. And then I realized, no, I need to be strict. Like, it's our advisory board. We need people that can actually help us, either by growth, by investment, or legal, or finance.
They have to do their job.
Exactly, because that's why they are on our board. Because otherwise, I want someone that has much more experience and much more life experience, business experience, can actually tell me, like, Rose, that's the right decision, that's the wrong decision, or give us advice. And if you're not doing anything or cannot even reach you for 3 weeks, yeah, I'm sorry, that's not going to work out. So I stopped with a couple of advisors. Yeah.
But now you have the entire team and also the advisory team, and you get the good vibe and chemistry.
Yes, we also have such a, and I look at both of you, I feel like we have such a good energy in the team, because my main goal as well is that I want to, every day when I wake up, I want my team to think like, oh, we work for something bigger than us, and that they feel like they're so valued. And I want to make sure that everyone that has their own expertise can also actually grow in that and actually show their expertise, and just to have also fun while we're doing it, because it's a lot of hard work and we will go through stressful situations. So I feel like communication, transparency, and just connection is so important. I feel like so far we've been having such a great team.
When you're working every day for the same thing and you're not seeing, because like building a medical device takes patience and takes time. It's not like we start now and we see the result instantly. It's going to be years till we actually see the result and actually scale the device as well. So with that constant motivation, you need every day to wake up and be like, I actually love what I do every day, even if it's like, step by step, because that's what happens when you're building a medical device. It's a slow process that takes a long time. So I feel like that's something that's extremely valuable for us, that we constantly check in with each other, and we're, trying to make sure that we actually enjoy every single day of, even if it's a stressful day, we want to end it on a good note.
And also just being transparent, because when things are going hard, I don't want to give this fake image like things are going amazing and people don't know what's happening. So I'm always making sure that people know what is happening, but on a way that I keep the team also positive. But yeah, I'm not going to lie, the last couple of years were
realities in your showroom.
Exactly. And I don't want to, because that's how I've been working for some startups, that the whole image was perfect and all of a sudden you lose your job. All of a sudden, like, things are going and you're like, you should have told us earlier, because we can also maybe come up with ideas or help you. So that's why transparency is so important with our team. But I feel also with you in this case and with our stakeholders, like, transparency is just number one priority for us. Because I always say values first, money after, because yes, of course, we all need money as a startup. But if you choose that above values, then it will also always hunt you down in the future, I assume.
Yeah, it's very important. You just asked the question why I decided. So the not just the dedication, but also the value. So the impact is very important for all of us, and I think it is the common value, and that's why it was very easy decision for me just to go this direction.
Did you experience any problematic, intense situations with startups you invested in?
Yes, definitely, many times.
I'm sorry to hear that.
There are many problems. Mainly, most common problems is the people. So, for example, I have a current case. The founder, the CEO is not accepting the advice, really, and not following the advice, and not just the investor advice, but also the advisory board. He has his own idea and is going that direction, and we see that it's not the best direction, and still he is not not accepting the advice. We are not changing, so we have to make some drastic change in that particular case. So everything is starting by the people, and that's why I was happy that you have this good team. On the other hand, it's just more a technical question, but how do you manage this international team together? So how it looks like a day for
Slack.
you?
No, we work with Slack, and I do work on multiple time zones. I'm okay with that because I'm not so good sleeper either way, and my ADHD is not really beneficial for sleep. So I'm making sure to always speak with all the time zones. We have multiple group chats, are really dedicated. And I feel like women are in general super organized with all the lists and all the things. So we do have a lot of lists and channels, but it's really beneficial because we're doing a lot of things at the same time. We're also making sure with our bi-weekly meetings that we're making sure everything is on paper. Shireen is our project manager, so she's really on top of tracking. We also use tools like ClickUp to make sure we're on deadline and schedule, and everyone can always see where we are in the project. So we are really efficient with time management.
And I feel like more than anything in any job that, in a team, it's essential that people know their responsibilities. And once people know what they're expected to deliver, and you trust them to deliver it, they will do it. Yeah. And we've been very fortunate to have all of our team is really motivated, and because we believe in the cause and we're very passionate about it, and everybody knows their roles, and we usually create like weekly plans for everybody and what to do, and I think that's how we keep track of things going on, because I work from the UK time zone, she works from Hungary time zone, and then we've got our director of microbiome innovation, Melissa, she works from the US. So we, try and segregate tasks based on time zones, and we just pick up after each other. And I think we just, yeah.
And also, I feel like the one thing I always told myself that I don't want to be as a founder is like micromanaging, because I need to have a team that I can trust. And I feel like that's why transparency and giving the opportunity that when things are going wrong or when things are going hard, that they feel comfortable and to come to me. So there will never be a case where something goes wrong and I'm not aware. Like, we are so transparent with each other, and we really have this group environment that we just want to really do this together. And I also told my team many times, it doesn't matter what time I text on Slack, just ignore my message because you don't have to respond. But I feel like we're just really friendly also with each other. Like, we're really friendly, hands-on, and really open in communication. I feel like that's important. And I'm also aware that, I hope that that's how I can scale the team with this energy, but I'm also aware that it's quite rare what we currently have in
and
the
I think
team.
it only has been possible because we're still a very small, lean team. But we get along really well even with our advisors, and all of us can reach out to them and ask for any advice whenever we need.
You just also met our advisor in London, yeah.
I did, yeah. I met Matthias just last week. He was visiting London as well.
Yeah, so it's very important that you see that you have a perfect team now. Yeah. But if you scale up, because you have to scale up.
And that's what I was just going to say, that it might be a bit, stressful at that point, or even difficult to have the same culture within as we scale. But I feel like if we're transparent and if we build that consistency across the team, then it is possible.
And I also feel like every individual in our team really feels like they can also share their ideas and like really share where their strength lies. And I feel like sometimes when you work in companies or startups or corporate, many people have so many ideas, but they never feel comfortable that they have the platform to share it. And I feel like we really provide that, and we really try to give that opportunity to the individuals. And so far it's working. But I know that we need to scale fast with the team, and fingers crossed, because we hope
we just find more people like us, like each other, and like we attract those.
But I do feel like having this pure and good energy, somehow we attract the similar people. Because even for an advisory board, our advisory board is so different from each other. And even though I'm the only woman, and we're looking for female advisors, even though I'm the only woman, never once it's like uncomfortable, or never once I feel weird. Like, it's such an open and strong, and we are like going point by point. We're like hands-on discussing everything and still just have a good relationship with each other. Is there anybody who's missing today from your team, core person, or you have everybody? No, Melissa then, but she is in Texas, so it's quite far. But you have all the position now, so you don't miss anybody. And we need to have a chief technology officer, yes, and we're discussing with Uniprism already with Timon to help us with this.
So I think in the executive team we have, of course, we've got the CEO, we've got the CCO, and we've got the CFO. But we still need the CTO, and down maybe like mid next year, once we've gone through the clinical trial phase, we might need a COO as well to manage our partners and stakeholders and all of those other things. And of course the CDO, Chief Data Officer. Yeah. Again, because after the clinical trials, there's going to be a lot of data that we will be collecting, and even with our surveys and everything, so like data is very extremely important for us, especially in Europe due to GDPR. Absolutely, especially in Europe, and I feel like it's good that it's strict, because then we've got this layers of trust and layers of like protection even for a consumer, so the consumer also knows that they can trust us, and our main goal is to never do anything without the consumer's consent. Yeah, especially now what's happening with Aura. And also like big Femtech unicorns, like they've had cases for years. And because I'm thinking about it as well, right? Because I want to make sure, especially now with all the news going around in Femtech and with all these women canceling their subscription, like what we can do. And I feel like the answer is so simple. Just let the user give the consent in what they would like to share. Because in our case, we will
collect data that's never been discovered before. So if the user knows that we're purely going to use it for research purposes or changes in healthcare, and they say yes, then we can share it. Why do you need to do secretly and like share this with Meta? And I find it just ridiculous.
And like data is amazing. Like we need data to actually bring innovation in healthcare. And if you have this data, you can literally change the industry overnight. But having the data with respectful boundaries and consent is our top priority. And we hope that we
can be an example also for other companies. Yes.
We want to be setting an example for every Femtech company out there, or not just Femtech, like any industry, because data is important anywhere you work. So,
and I'm also already thinking like, right now we're working so hard to get this device into market and to get a strong name and become a leader. And then imagine at the search, because it always comes out when there is a data leak. Imagine after like 5 or 10 years when you're such a big unicorn and then you have these court cases, then basically everything what you work for,
it's just gone all to
shambles. Yeah, so that's why for us, data protection, transparency and consent is like really, really important. We have daily conversations already with our legal department as well, how to set it up right from the beginning. So yeah, that's it's really important for us. Yeah.
How did you get into like female health? And you even did a PhD in like gynecological disorders and genetic disorders. So how did you end up in female health?
Yeah, I didn't end up in female health. It is just by chance we met a couple of months ago, and I really liked the story and your personality, and it was the reason. On the other hand, since we posted this information, I received 2 to 5 requests from different Femtech companies and female leaders that they are very happy, and I get this information that they are suffering so much, that they don't have a funding, they don't have the attention. And I was just thinking, and yesterday we were talking about a bit more detailed, and I will talk about other investors next week in Czech Republic, that I think it will be our core focus now, from now. It's because it's so problematic, and it's so important that it is for us, as I mentioned, the impact is very important. So it's money is just a value, and the tool is not a value; it is just a tool. But the impact, what you are doing, and other companies, they are suffering because they don't have this attention and funding. I think it's very important to support them, and I think it's very important.
And I think that was also the whole core message of the shoot, with the additional information and data that we shared about the pressing needs in women in business and women in health. So I'm happy that these women also felt comfortable to reach out to you and share their story. Yeah.
When you generally invest in companies and in startups, with your experience, how do you decide? Is it the key driving factor of the team, the founder, or is it the concept maybe?
Definitely. So, of course, we are doing the usual way of the due diligence, the professional, legal, and the financial. But as I mentioned before, the team is the most important for me, because with a very good team, not the best company or not the best product, this could be also viable, and then you can you can be a game changer. But even if you have the best company, the best product with a not so good team, you will just suffer, and most probably you will fail. So that's why the team is the most important. The dedication, I do not see this dedication so frequently. Many funders, they are thinking they are dedicated, but they are not dedicated. They are just a bit crazy because of the unsuccessful pathway. They became a bit maniac and crazy. So it is not dedication. So it's very important that
to differentiate.
Exactly. So this dedication is more important for me.
Yeah, because also some seasoned individuals in the field also told me, indeed, it's always people or funds. Because imagine when the funds open and you get this investment, but then you have no team, you have no one strong to help you, and then you're not only losing the return of investment, but also like so much time goes to waste. So it's people is really important. Yeah,
and we are talking about rounds, so it was the first round, but we have to think about the second and third one. If you don't have the team, so it's very nice we have the first round done and the you reach the TLR2 or any milestone you reach, but what's next? So it's very important that the continuity. So we would like to reach an exit point. I don't know what is your current expectation for what is your exit strategy at this moment. But anyway, so it's a multiple step, and there is many steps to reach that point. And if you just focus on this particular round, it will be not work anymore. Yeah. So you have to make a very holistic view. Yeah. And for this holistic view, you need the team, because the team is a constant, and all the other things are changing. Yeah.
And I feel like holistic, it's a good word, especially in startup environments. It's also for women, because we have, of course, different hormone cycles than men, because we need to also work around our cycle. And I also learned the hard way that it's not efficient to try to work 24 hours a day. But because you have the dedication, you also need to find your balance and like, okay, what is still like be dedicated, what is still healthy, without also losing yourself and like losing your environment. And I feel also with all the startups cohorts that I've been through, I've seen a lot of companies fail or like continue because you need to push, and you will lose relationship, or you will have a hard time making time for friends and family, and especially in the beginning to like set up the company. And I feel like that's where the holistic view also comes in place. And I also realized that I cannot build a company on women's health and women's wellness when I'm not listening to my own advice. So after like 2 years, I was like, no, I really need to implement the holistic view for myself as well. And I feel like that's what I'm also trying for the team, because that's important. Like people are important, but to keep people also balanced and healthy during the crazy journey of startups, it's also important.
Yesterday, I received a question what I'm thinking about the work-life balance. You know, it's a very sexy wording nowadays. That and I mentioned, and still I keep this opinion, which is not nice. But for me, the people who are just talking about this work-life balance, for me it is just lazy and untalented people. They are more for the corporate, but not in a startup where they cannot accept this.
No, you can, honestly, because you see me anytime on Slack. How? Because like whatever I am, I'm just working, because also I love what I'm doing. So it doesn't feel like work. I not have it's now 5 o'clock, I'm exhausted, I'm gonna clock out. No, I'm gonna get so excited. And sometimes I get ideas at 2 a.m. and then I'm still working on it because I want to like work it out. It just makes me, it fulfills me, because especially as the founder, I need to love what I'm doing. And I feel like that love and that passion and dedication then trickles down to your team as well. But no, if you love what you do, you never work a day. That's such a true statement. So yeah, it's just that's important. But if someone asks me work-life balance, I don't know how to answer.
But I feel like it's also more about taking care of yourself. Because if you can't take care of yourself, then you can't build something. Like, I think it's really important, even just like a walk outside for like 20 minutes can do wonders.
And that's also what I mean with the holistic. Like my morning routine is I do praying, I do walking. It's not just like immediately open my phone and like start to do emails. I just take like an hour for myself and like a bit slower start.
Because that prepares you for the rest of the day, and it sets the right start towards the day. Like you're walking 24 hours tomorrow, so you must know.
When we're talking about work-life balance, the schedule you just shared with us,
yeah, that feels impossible. Pretty intense.
Yeah, I'm working a lot, but every morning I start to walk 5 to 15 kilometers. So it's more, not 20 minutes, it's 1 or 2 hours.
Do you work during the walk?
Yes, inside.
in your head, yeah.
But I don't get my phone with me. It is just I'm not listening music, nothing. Just walking on the beach.
Just thinking about, yeah.
Yes, it's thinking. It's fortunately I'm living very close to the equator, so it's always nice weather. So 365 days I can do this.
That's nice.
This walk.
Yeah.
And it's very fresh on the beach, and but it's very important for my brain, just cleaning up the trash, and also just get the new ideas. Especially your brain is the more active, you get the best ideas in the early morning. So from 5 a.m. until 10 a.m. is the best.
And I'm also sometimes on the walk I am working. I'm like walking like this and working. But I also do that in the evening before I go to bed, because that's where I feel like the balance should come into place. And sometimes also during the day I go for a walk when I have some time. Just need to, after some intense meetings or like some back-to-backs, I just need to have at least like 30 minutes of outside.
No, the walking is very important. It is just the connection in your brain. It's so many muscles you are working. So that's why the walking is very, very healthy. So that's why against Alzheimer is the best prevention.
It's also about like filling your own cup before you can pour it out to other people, because you've got to have the same energy for everybody you speak to throughout the day.
And it's crazy how just taking the morning, let's say an hour or like 1.5 hours for yourself, because that's the only thing that really changed, because I'm still working a lot. But like when I took my phone, immediately working and immediately chaos, and you do that until you go to sleep, that's when I noticed, okay, I need to change, because that's really not a healthy work-life balance on a way that as a startup founder, you of course need to do a lot, but it just doesn't take that much time. Just small moments for yourself throughout the day, and it's just holistic view of it.
Yeah, that's why I moved to Singapore. So I had so many issues, or health issues I had because of this hard work. And we just moved from one day to the other immediately, and I completely disappeared, because this 6-7 hour time difference between Europe and Singapore, or 12-15 between US and Singapore, the morning hours are no emails, no phone calls.
How do you manage
so
that time zone then?
During the evening, so I have calls during the night, but I try to avoid them or just minimize it. But still, the morning hours, so I get always a very fresh start of the day.
How many years are you now in Singapore?
7 years.
Oh wow! Do you like it there?
Yeah, I love it. Anyway. It's really nice, and also it's important question to you that you are focusing now or not focusing. Just most of my team and the focus is partly in Europe and US, but Asia market is a huge.
Absolutely, and it's growing tremendously.
Exactly, and very quickly.
Very quickly.
Yeah. So, and also you mentioned that the ethnicities is a huge impact on your product.
Actually, through correct me if I'm wrong, but we're gonna go live with the voice of customer today, and we're actually also focusing on Asia, right? Yes. Yeah. So it's quite exciting that we can go live today, and we're focusing on different ethnicities as well. So we are quite interesting. Of course, we're going to share it with you as well. What the results will be.
I think the main idea for the new voice of customer that we're launching today is also to get to know more about what the consumers actually want. And we're trying to understand more about how comfortable they are in their current fertility journey, in their current, journey as tackling whatever they're tackling as females. Yeah,
in Asia is the only problem, just the difference mainly is the culture and the religion.
Exactly, and that's also one of the huge important factors why we've included South Asia as one of our target audience for this voice of customer, because there's a lot of taboos around what can be inserted inside a vaginal canal and what cannot. So, and with my own experience, I've met with women, even doctors from that part of the world, who think that just inserting even a tampon can take your virginity away. Yeah. So I feel like that is something to be, these women are doctors, and how are they still thinking like this?
It's a huge educational challenge for you.
It is, tremendously. And that's something that we're trying to break with YON E, and it's just about education. It's information that women don't have. And some what's that word? Beliefs. So some beliefs that people have through culture or where they've grown up has a huge impact on, your daily practices.
Also on future generations.
And future generations, a mum who thinks that using a tampon can break her virginity is going to teach the same thing to her daughter, which is extremely harmful, I think. And it takes away this power of making her own decisions, which are right, not just medically, but also socially. So it's a bit it makes me sad that people don't know things, or they just, I don't know, it's so hard to put into words as well.
But you don't should be sad, so it is just a challenge.
It is, and I think that's also another
a challenge and a big responsibility for us, and I feel like we all carry that understanding and knowing that it is such a big responsibility, and it is such a beautiful thing as well to be the company that's able to not only open the doors, break taboos, but also really educate future generations and current generations. And I feel like that's such a beautiful thing. And that's why with our device and with our app, we also want to target men, because this is also where a lack of a lot of education is lying. And there are so many single fathers, for example, raising children. They need to have that education as well. And I feel like that's why it's so important and beautiful at the same time that we carry that mission and that responsibility.
And we hope to tackle all of these things with like trust and utmost sensitivity, because we understand not everybody on this table or that table that we're trying to build for Yoni will come with the same thinking background or cultural views. So we want to be as respectful and as sensitive towards everybody, but also set that standard and bar that people are able to make decisions, informed decisions, regardless of, you know, if they're a man or a woman. Or
So it's just my final question: that how do you see YON E Health in the next 5-10 years?
heavy
Exciting
question.
No, I love that question. So in the next 5 years, we of course obviously launched our device within Europe and other continents, and then we have also in-person stores. And actually, I would like to do something with the profits to actually build women's shelters or safe houses to give back full circle. So I would like to set that up in of course, in unfortunately my childhood, but I know how it is to live there and I know what can improve. And I really would like to dedicate also part of the profits to that, yes.
And in your point of view?
So topmost priority, definitely device going to market, being successful, doing amazing things with the data we collect, iterating the device, you know, being the first ever device to do wonderful things, and also educate women. Most importantly, I'd like to also have workshops that we discussed about this a couple of weeks ago, that we'd like to partner with clinics, with hospitals, and with maybe academic institutions to have workshops just to like educate people, and so that they're able to make very informed and conscious decisions about their own bodies, because that's extremely important in healthcare, and that's where lots of people are lacking, and that's where the pharmaceutical companies, they take advantage of, and that's why it's like $1 trillion industry, because people are not able to make the right decisions for themselves.
And that's why also we will continue publishing our own studies, and especially when we have the data aspect from our device, from our users, upon consent, of course, that we will continue to make a change within research and pharmaceuticals and basically really make that impact. Yeah, so that's our goal.
I think it'd be really nice to see our work just come to life in the next 5 years, and that will be like the most gratifying experience, I think, for us.
I hope I can also help in this
Absolutely.
journey. And
You already are. Like, you're like our first stepping stone. So we'll go in this journey hand in hand, I'm sure.
Yeah, and the fact that already these women reached out to you, that then sharing their personal stories, and also for you to see the pressing need and for you to make a decision that Femtech will be the main priority. Thank you for that, not only from a personal perspective, but really from all women in business. Yeah.
Thank you so much, and also thanks for
Thank you
coming
for
today.
the invite. Yes.
Thank you for having us. And it
Lovely
was
to be
really
here.
such a fun conversation. And
Thank you so much.